Good evening, everyone. So, I will be giving you a general orientation as well as the guidelines for the limited face to face. I believe that this would commence this coming September 20, Monday. And most of you are already here in Cebu City. Some of you are traveling. So, hopefully, I can see you by that time. So, let me start with the general guidelines. So, general guidelines is very important that you students should adhere because it's one way for you to be guided and it's one way for you to make sure that you follow the different policies, protocols, procedures, as well as know your roles and responsibilities once you're inside the school premise. So first, all students must bring personal hygiene kit. So what is inside a personal hygiene kit? So that includes your 70% alcohol, your extra face mask, as well as your face shield. Always remember that you have to wear your face mask and face shield at all times. As much as possible, face masks that should be medically grade and face shield that covers totally both your eyes as well as your nose and your mouth. And it's also advisable that you have to bring extra because in case that it will become wet due to sweat, at least you have an extra face mask for you to replace the soiled one. The second is every student must wear face mask and face shield at all time inside the school premises. Okay, so the only time that you're going to remove your face shield and your face mask is when you eat or when you drink water. You have to make sure that you always wear it properly and make sure that you're not going to remove it. Okay, so once you're inside, make sure that part of the requirement is to properly wear it. The third is you always have to maintain 2 meters social distancing at all times. Okay, so make sure that you adhere with the social distancing because it's one way for us to avoid the cross contamination. It's one way for us to make sure that we are safe because we are far from each other. Avoid interacting with your classmate in a close contact way. Make sure that you guys will be talking in at least 2 meters away, okay, from each other. And avoid staying in crowded places or do not pond or do not crowd with other students inside the school premise. Next is you always have to do your hand hygiene. It's very important that you have to wash your hands. There are specific stations in which you can wash your hands. You guys are being provided with soap and of course water for you to wash your hands. If you can bring your own soap, that's good. If you have a preferred soap to use in your hand hygiene, that's much better. However, the school provides you everything to address your hand hygiene at all times. Next is we have to emphasize that there is no canteen which is open or available at this time of our limited face to face. We highly encourage you to bring your own food and water. So make sure that you make your own baon or at the same time you just have to bring na lang in order for you not to go outside or you will go to other places such as the parts of Imol or Jones just to eat. So we don't allow students to go out in the school premise just to buy food away from the school, which is too far. However, we encourage as well that you can somehow have a delivery of your food. You can utilize Food Panda or Grab Food for you to get your food, okay? But we always discourage that our students will go out in the school premise because it's one way to control the cross contamination of microorganisms. And we also have designated places for you to eat. So make sure that you read labels well and you have to consider as well the social distancing as well. Okay, when you eat. It's okay to eat by group, but make sure that you guys would stay away from each other at least 2 meters away from each other. Next is strictly no eating inside the room. The room that we pertain here is the room that you are waiting while it's your turn to do the return demonstration. We also emphasize that students should not be eating in the lobbies that is seen outside the demo room, because you might be able to transmit, no, microorganisms from the other students as well. So it's much better that you go to designated places in which you are allowed to eat your food. And if you want to eat, you are required to get out from the room and step out from the waiting lane. However, when you go out, that doesn't mean that you will not be catered if you are the next to present. I suggest that you budget your time, you manage your time, you make schedule in terms of the time or the specific time that you're going to eat your lunch or probably your snacks. Okay? So it's okay to eat. Make sure that you are not eating inside the room or outside the lobbies. Next, health checklist survey prior to going to school should be accomplished by students. So I'm making right now a health information survey that you guys should fill in every time that you go to school. Okay, so inside that survey is your name, your email, your body temperature prior to going to school, the signs and symptoms that you might be experiencing prior to coming to school, as well as certain informations that are relevant if you are been isolated or being quarantined. The reason that we need to have the health checklist survey, it's because we need to make sure that we can monitor the health condition of our students prior to going to the school, so that if we can identify that these students already have signs and symptoms or they aren't feeling well, we tend to advise them to seek medical consultation, okay, directly. So the hospital is open 24/7 every day. You can have your consultation if ever, God forbid, you will have signs and symptoms of COVID infection. Okay, so you fill up the online form, which I will be giving to you, and the other students would also get that online form that would be given by the respective clinical instructors or preceptors. And then students who has symptoms such as body malaise, fever, cough, sore throat, diarrhea are advised not to come to school anymore. So that is why I need to monitor you as well. So prior to coming to school, probably before 8 o'clock that will start our return demonstrations, you already sent that one to me. Okay, it's in a form of a Google form. Okay, so consider giving that one to me prior to coming to school. If you can accomplish that before 8 o'clock, say for example 6 o'clock in the morning or 7 o'clock in the morning, that's fine. For as long as you should submit that before you are inside the school premise. Okay, so because it would forfeit its purpose if you will be sending that one and you're inside the school premise but you already experience the signs and symptoms, so that's already too late. No, you might be increasing the chance of spreading the microorganisms to other students or even to the faculty or to the other school employees. Okay, and then once student will inform the teacher that he or she has signs and symptoms of COVID-19 infection, then us students will be coordinating to the dean so that we will be able to go to the next process as to how can we refer students then. Okay, so usually we refer you to the clinic nurse for consultation of the physician if possible, or do telemedicine, no, online consultations if you'll be scheduled, or if not, you can walk into the emergency room as per advice, because you have this unlimited consultation fee once you go to the ER for consultation. However, if you will be catered in the emergency room, I just would like to emphasize this, that you have to pay for the PPE of the nurse who will be taking good care of you. So your consultation is free. The consultation is worth 350 pesos and that will be waived, no? So that it's for free, but you just have to pay for the PPE or the personal protective equipment that is being used by the nurse. So usually that's around 450 something, okay, but it would not go more than beyond 600. Okay, but if the doctor will also be wearing the PPE, he will be assessing you inside the triage or in the emergency room, then you also have to pay for that as well. So you will be paying two different sets of PPE that will be used by the nurse as well as with the doctor. Okay, so take note, there are miscellaneous charges. Okay, and not everything is for free. Next, teacher must review the form and properly advise the student. So that would be my advice for you then. Okay, if you have signs and symptoms. Okay, then students must be in civilian clothes when traveling. So there was this question that was raised during our faculty meeting. What if we students are just residing in Orhelio and it's just 3 to 5 minutes walk away? It's okay for you to wear your uniform provided that you have to wear your lab gown. Okay, so your lab gown will be protecting your clean uniform prior to entering the school premise, and you just have to take off your lab gown once you're inside the school premise. But for those who are traveling outside Orhelio or in the other cities or even some of the province, no, na you guys would really wanted to travel, we highly recommend that you should wear your civilian clothing. And you have to bring your uniform. And once you're inside the school premise, you go directly to the changing room, which is in the bathroom or in the CR, and then you have to change it. Okay, because we have students who would prefer to travel outside Cebu City coming to school. Okay, so just make sure that you change your uniform once you're inside the school. So how about if you will be going home? Are we going to change our uniform into civilian? I leave it up to you. The school leave it up to you if you're going to change it. But my advice will be you need to change it, especially that you are commuting or you are utilizing the public transportation. Why? Because you are wearing white and there might be a connotation coming from the passengers na you might be taking good care of patients in the hospital or even COVID-19 patients, you might be discriminated. So to avoid that certain circumstances, then I strongly suggest that you have to change your uniform to civilian clothing when you go home. Okay? So next slide. Follow the guidelines shown in the video shared by your teacher. So I shared it already in our Google Drive. I hope everyone saw that video. I think that is just 3 to 4 minutes, no, of video presentation on what to do when you are inside the school. Okay. Next, go directly to restroom located to FINMA Hall or SHAS building ground floor for changing your uniform. So when you change your uniform, make sure that you go to FINMA Hall's comfort room or SHAS building's comfort room. Okay, do not utilize comfort room which are located in the hospital because you are not allowed to go inside the hospital. Okay, no students aren't allowed to go to the hospital to dilly-dally or to tour. Okay, so you aren't allowed to step in the premise of the hospital, just in the school. Okay, so you go directly to your designated room assignment. My students who are under me are in third floor. Our room, our waiting room is in third floor. That is room 301. So it is not just you who's my student will be there, but there are also students coming from other group who would be there as well. Okay, so make sure to maintain social distancing, avoid talking or overcrowding, and make sure that you guys always properly wear your face shield and your face mask at all times. Okay, so I'm trying to emphasize that from time to time. So here are the room assignment. No, so for the sake of those students who would be able to see this orientation, please take note of the following room assignment. Okay, so if you're, say for example, your clinical instructor is Sir Anthony, then you will have your room at 209, Sir Napoles at 301, so on and so forth. So I believe that the limited face-to-face is not just limited to fourth-year students, but as well as irregular third-year students and regular third-year students, right? So take note of this one if you don't have any copy. But again, my students are in room 301. Okay. We also have guidelines. while waiting for your turn in the return demonstration. So while waiting your turn, students are encouraged to study and prepare themselves. Okay, so you are not encouraged to utilize social media by doing group picture taking, by doing TikTok with a group or whatsoever. Okay, so we tend to make sure that we cohort you in a particular room because we give you ample time to study. Okay, so in the return demonstration, in my end, I will be giving it time for those who will be presenting the return demonstration. Okay, just to make sure that we can hit our target time. Okay, it should be time bounded, so you will know your schedule and you will know your decking because we will agree with each other once we are in the school already, because there might be some who couldn't go inside due to unforeseeable crisis, right? So it's good that we have to do our decking for those who are present, okay, inside the school. Now, say for example, the student um, is done with the return demonstration, can he or she go home? Well, if there are no additional instructions from the clinical instructor, say for example, in my end, we will not be having some supplementation of lectures as well as doing exams right after the return demonstration. That is fine to avoid overcrowding. It doesn't necessarily mean that students should stay in the hospital premise for 8 hours. Okay, so if students wanted to go home, much better to avoid crowding and at the same time to decrease the chance of cross contamination. Okay, and by the way, let me just emphasize, in my students, you guys are only allowed to do the return demonstration once. There will be no more second chance. Okay, so once you already perform, that would be your final presentation or performance, and final grade will be given then. Okay, then next, 1 to 2 students are only allowed inside a specific room or venue or with a teacher for the return demonstration. I strictly impose 1 student inside who's allowed to go into the vicinity while we are doing the return demonstration. You have to make sure that your lines are keep open. I will be texting you or I will be messaging our group chat or our GC to inform who would be the next, okay, or to inform that there would you have to prepare because you will be the next to present. Okay, so I suggest that you will just stay in the designated room that you are entitled to have that room, okay, to study. And once you receive my messages at the time that you're going to go into the room in which you do the return demonstration. Okay, we'll do draw by lots once we will meet this coming Monday or in our limited face-to-face. Okay, so that's the time that we will know who would go first and who would be the last on the list. Other students will be waiting outside the lobby or specific waiting room. Okay, so as much as possible, no dilly-dallying in the lobby. Okay, so make sure that you're inside the room and concentrate. Okay, you might be able to ace the return demonstration, okay, because you have the concentration and you keep on studying. Then strictly no eating while you're inside the room and lobby. No? So this has already been emphasized. So if you want to eat, please get out in the room and step out from the waiting line, and you can go to a specific area in which you can somehow eat your snacks or lunch or your breakfast if ever. Okay, so as you can see here in the picture, for those students who are assigned to occupy second floor AVR and 209, you must use the stairs which is just adjacent in the lobby of the faculty room. Okay, I believe that you guys are kind of familiar on this. Okay, so this is where you're going to enter. Okay, avoid going to different entry points. Okay, because there's only a designated entry point for the respective rooms that are designated as well. So for those who would be occupying third and fourth floor, you must use the stairs below. You can see that the arrow is pointing there. No, there is a stair that is being constructed. If you are not kind of familiar, no, because this is just newly constructed. This is just adjacent to the faculty room of the medical technology, the College of Medical Technology. So you can utilize that stairs going to the third floor and fourth floor. Clinical instructors will be utilizing that particular staircase as well. Okay. Guidelines in case students will have symptoms. So students, please inform immediately your teacher. Teacher, inform directly the assistant dean, who's Dr. Mojenes, and assistant dean will immediately inform the school nurse for any advice. Okay, it's either you have your consultation with a physician, or if the physician isn't available, then we can do the ER consultation or the triage consultation at the hospital. So students are being classified into alpha and bravo situation. Okay, so the word alpha is somewhat like student A. Word bravo is somewhat like a situation of student B. Okay, so there are two different types, no? So particularly dry cough, fever, tiredness, no? Inside or outside the campus is being felt or are being felt by the students, no? So say for example, alpha, okay, alpha student, once these particular signs and symptoms being identified, they have to proceed to the clinic to seek consultation. You have to do this one after giving up advice coming from the assistant dean or your clinical instructor, okay, because there should be proper referral prior to going so to that particular part or area. Then okay, again, alpha proceeds to clinic to seek consultation. All right, so the down arrow points the next step. Alpha is immediately placed in an isolation area and undergoes consultation with the university physician. That if the university physician is available or he or she is inside the school premise. Okay. Next, bravo situation. So student who is in bravo situation, again, situation should be relayed to the school nurse, and the school nurse facilitate telemedicine consultation with the university physician. Most probably this would really happen, telemedicine or teleconsultation. Why? Because I doubt if our university physician would have his or her duty in school, no? Anyway, we can do telemedicine with online consultation, provided that there would be some gadgets available during the consultation. Okay, so if that's feasible, then probably we can have that. Okay, that's more safer. That's safer compared to face-to-face consultation. So both alpha and bravo. Okay. Once they're done, once we accomplish that particular part, as you can see, the two arrows pointing down. So those two, the university physician gives advice either to alpha and bravo, which needs to warrant or which needs to have warrants of quarantine or home treatment with medications or classification of situation. So at this time around, the doctor would advise you to give you medications. If you have these signs and symptoms, will advise you to do RT-PCR or swabbing, and will advise you with some medical management and interventions. Even laboratories could be worked up in this part. Okay, so we just have to wait for the advice of the university physician. Okay, the school nurse then tags alpha and bravo as PUM. Okay, so sends notice of situation to Safety Council, the COO, HR, Student Life, and CSDL. Okay, so all those that are in top management in the university would be relayed with the information, just to make sure that we have the proper documentation as well as information are being properly relayed. Okay, as well as reporting as well. It's very important. Okay. Alpha or Bravo is placed then in home or school quarantine. So there are times that there are LGUs that won't allow those who tested positive, even milder symptoms or asymptomatic patients to be inside the home nor in their household. So if you really wanted to have your quarantine here in the school, because we have a designated area here in school that employees as well as hospital employees in the school and hospital employees can have that kind of benefit while they tested positive. Okay, so usually that's in the Maroon Lodge or in the barracks. Okay, so you have the choice of doing so. You will not be paying the the accommodation, but you just have to make sure na you will be paying the food, no, that is being prepared by the dietary. So that's in the morning, afternoon, and dinner. Okay, so that would be the plan. But if you prefer to go to an isolation facility, say for example in an inn or in a hotel which is accredited by IATF, then we can also do that. However, the university nurse will be the one to monitor you then. Okay? Although you are in the school premise, if for example you choose to have your quarantine here in school, that's still fine. Okay? That is also fine, right? Okay. So next is, let me see. School nurse track progress of Alpha Bravo twice a week. No? So school nurse would track the progress of Alpha and Bravo twice a week via mobile. So every time you guys will report, no, with the school nurse with your temperature, if you still have the signs and symptoms, he or she might be providing you a checklist. No, by the way, our school nurse is Miss Lay, and she is part of the student life if you happen to know her. Okay, so she'll be the one to monitor you from time to time. Okay, so with that being said, after 14 days of your quarantine, after you surpass the 14 days of quarantine, Alpha and Bravo will secure medical certificate to the university physician before returning to school. So you have to secure this to I think this would be in student life, no? You have to go there or contact Miss Lay because she will be contacting you, okay? And she will be the one to give you instructions. So it's very important that you have a proper communication and collaboration with each other. Okay, then school nurse reports progress to safety council for reporting, okay? And then that ends. Then you can go back to your limited face-to-face exposure again. Okay, so sometimes what I notice, patients are being released in their 14 days of quarantine if they do not have signs and symptoms. Okay, usually they're been taken with their maglumi. If the maglumi is okay, say for example the patient developed already the IgG, which is an antibody of post-COVID exposure, and the maglumi is negative, meaning to say that the patient isn't infectious, or the IgM, okay, the IgM is negative or non-reactive, then we can somehow give medical certificate, or fit to work to these particular patients, particularly the employees of the hospital and the school employees. Okay? Alright, I think that would be it. Okay, so if you have any questions or any clarifications or any concerns, feel free to message me in the messenger, even though that you are not my student, or if you have any concerns or your clinical instructor wasn't able to reply on you and you need urgent answers, feel free to contact me directly. Okay, by the way guys, make sure that you wear your complete uniform this coming limited face-to-face, because that's really the mandate of the school. Okay, so if your lecture uniform will not fit on you, then you can use your CHN uniform. If your CHN uniform won't fit, you have to use your duty uniform. So either of the three, for as long as you're on a uniform. All right, make sure that males should cut their hair. You have to shave your beard as well as your goatee, remove that. Females, no colored hair. Hair should be well kept with a hairnet or properly bun your hair. Okay, so even though that you do not have your return demonstration, make sure that you bun your hair. You unbun your hair if you are outside the school premise. That would be my mandate for my students, okay? So that I could somehow, you guys are really already ready na, no? So you don't need to fix your hair anymore because it's already bun. All you just have to do is to wait for your turn during the return demonstration. Okay? All right, so if you have any concerns which is on your mind, feel free to inform me or message me in our GC or in the Facebook Messenger. Okay? All right, so thank you for listening and hope you guys learn with the guidelines and with the orientation that we have. So have a great day.